Welcome everyone to Social Impact Live. I'm Richard Hara, your host, and this is our weekly conversation with members of the Columbia School of Social Work community. I'm pleased to welcome to the program today two guests from the Release Aging People in Prison or RAP campaign, Mark Shervington, who's the statewide community organizer, and also Melissa Tanis, who's a communications consultant. So Mark and Melissa, welcome. I'm also pleased to welcome to our program today a repeat guest, Cameron Rasmussen, who's a programs director for Columbia University's Center for Justice. So to the three of you, thanks again for joining us today on Social Impact Live.
Thank you for having me.
Thanks for having us.
You know, with COVID-19, we're at this interesting point, and I don't know if it's an inflection point or not, but certainly there's renewed attention on what's happening with incarcerated people now, right? In the face of this pandemic and the special and the extra ordinary vulnerabilities that they face being incarcerated, and sort of pushing forward the debate about or the effort for decarceration. And, you know, we're planning to talk today about decarceration in terms of public health, but I think more generally as a movement. I wonder if one of you could provide a little bit of background with regard to decarceration, you know, both in time and sort of what this conversation has looked like recently across the country. So Cameron, if you might get us started.
Sure. I mean, I guess there's a lot to say, and I'll try and maybe summarize it quickly in that people have been trying to get people out of prison. I mean, decarceration at its most basic sense means decarcerating and getting people out of jails, prisons, and detention centers. And there have been efforts for decades, but certainly more sort of visible efforts in the last couple of years to get people out of detention centers, to get people out of jails, and to get people out of prisons. And we're seeing this in New York City and Rikers Island, in New York State. RAP has been sort of building a campaign for several years now. And then the work around immigrant detention centers has been strong and vibrant for a long time, trying to get people out. So that's sort of the foundation, the landscape in which we now find ourselves, where people were already threatened by the systems of incarceration, and now with COVID-19 are at more risk.
Okay, thank you, Cameron. And Mark, do you want to add to that? And maybe tell us a little bit more about your particular efforts and the efforts of RAP in this movement?
Yes, certainly. Thank you. Well, RAP began as a response to the crisis of mass incarceration, particularly in the state of New York. But we do partner with allies from coast to coast, which, by the way, incidentally is a hashtag we are using as part of our clemency campaign. And essentially, we work to solve the crisis of mass incarceration by focusing specifically on people who have served long sentences that unfortunately have become death by incarceration sentences, in the sense that they are so long that people will usually not survive long enough to get out in the first place. Secondly, we are working to level the playing field when it comes to the parole release process in the state of New York.
Yeah, we've had Vinny Schiraldi on and Marcellus Morris in previous programs to talk about the problems with probation and parole in New York State, certainly, but also more generally. And I think, you know, it's important to sort of get a picture of, I mean, what this looks like for people, right? And not just people who are incarcerated, but also their families. So when we're talking about, the needs of older incarcerated people and so on, I mean, I think that's hopefully something that you can speak to, Melissa, with regard to the stories that you've heard through your work with RAP and the RAP campaign, and what people need to know about this situation.
Yeah, so with people who are aging in prison and who have spent a long time in prison, you're going to have underlying issues. A lot of them are going to have a lot of underlying health issues. It's been proven that being in prison actually ages one's body. So your physical age may be different from your actual age. So people who are 55 actually may be experiencing problems similar to 60, 65. So it creates all these issues for people who are older and aging just generally, but especially when there is a global pandemic, getting them home and getting them in better healthcare is crucial. And getting them home, I think a lot of people forget that there are family members who are waiting for them to come home and who are terrified on a regular basis, but also especially during a pandemic, knowing how little health care they receive inside, knowing how impossible it is for them to actually physically or socially distance, knowing that the conditions are just not conducive for somebody to recover and heal from something like this. And so just a lot of times people will say, like, because our demand right now is for them to be released. And a lot of people will say, well, where are they going to go? And it kind of blows my mind that there's over 43,000 people who are incarcerated in New York State prisons, and people don't think that they belong to families or to communities. And they think that we have failed people so poorly that they don't have places to go back home to. And while that certainly is an issue, that's something that is not a justification to say, well, let's just keep them behind bars. Like, why not provide support for them when they come home? And there are plenty of places right now who are still providing support for people who are coming home who do not have it. But outside of that, there are people who are waiting for their family members to come home. I mean, my dad was incarcerated for 22 years. And he was not able to spend the last month of his life home with his family. And that was awful for me to live through. And so I know what it's like to not know what's happening with your family member, to not know what kind of health they're in, to get no answers from prisons when you call them, and just to feel entirely helpless. And it's just not a good situation to be in. And so that's why RAP and me personally have been really advocating for people to be home with their families, because it's incredibly important normally, and it's incredibly important during this pandemic.
All right. Well, thank you, Melissa, for painting that very human picture of what the costs are, right, for people and their families dealing with incarceration. I'll ask Mark to maybe share any stories that he might have heard with regard to how people are adapting to COVID-19 and its impact on people, incarcerated people and their families, in just a moment. But I want to remind our audience that we do reserve the last 10 minutes of the program for Q&A, and you can put your questions in now, and if we have an opportunity, we'll pose them to our panelists earlier rather than later in the program. So please feel free to submit your questions in the chat box on Facebook Live. So yeah, turning back to you, Mark, stories that you've heard from people, what it's like now in the midst of this pandemic, being at risk in jails and prisons, and how that's affecting family, perhaps?
Well, in New York, I've been getting reports from some of our members concerning their loved ones incarcerated, and I'm getting various reports depending on which prison that people are in. Some places, the treatment and the conditions are horrendous. In some places, like Elmira, for example, I spoke with a woman last night whose husband is incarcerated, and they are allowed to cover their faces with handkerchiefs, not masks, as we may have available out here, but they're also allowed hand sanitizer. The visiting room has been remodeled to accommodate social distancing. And there were, by this gentleman's report, no known cases. In other places, at various areas in the prisons are being turned into quarantine areas. At Fishkill Prison, for example, they have prisoners digging mass graves. Some places, the prisoners are not being tested unless they're practically on their deathbed. Some places, prisoners are afraid to seek medical attention, despite being symptomatic, because prison health care is generally like non-existent. I could tell you horror stories about that from my own experience. So the numbers, despite what you may hear in the media, are in fact skewed. They are most likely underreported. And, let's all bear in mind that, the problem that led to mass incarceration in the first place, that got us to the point where we are now, is it was engineered in the sense of, certain communities were being targeted for criminalization, which is, by some scholars, a form of social engineering in the first place. So this, the problem that the crisis that we're dealing with now, is like the end result of those years of criminalization of certain communities. Like, for example, here in New York, there was a study done that came to be known as the 7 Neighborhood Study that was done by Eddie Ellis, and I cannot remember the other gentleman's name. Basically, prisoners themselves figured out that most of the state prison population comes from 7 specific neighborhoods. These are the places that also experience stop and frisk and a variety of other, I would say, offenses against community stability that basically led to, the prison population being only from these areas, despite the fact it didn't add up in the first place that, well, how could only people from these areas be the majority of people in prison? That didn't add up. All of this produced the crisis that we are dealing with now, whereas people are basically being subject to the death penalty, because of where they're from and where they are. No one in prison, New York prison right now, was sentenced to die. So we're kind of like in a weird place, and it's a moral crime, if nothing else, to allow people in that situation to not, as Melissa pointed out, be released to their families or to the reentry service providers who have pledged to provide, the assistance that people without resources need.
Mm-hmm. Well, and I guess it makes for a fairly complicated picture, certainly for just New York State. And I want to circle back to Cameron and maybe get your thoughts about what this looks like nationally. And, is healthcare in prisons and jails, systemically something that, why is it so bad, and why aren't we doing more about it? And it's not just, medical, it's also mental health treatment, right? That is also lacking within the system. So how did we get here?
Yeah, I'm going to answer your question in a way, and hopefully it gets at least part of what you're asking. We as a country have invested in incarceration and punishment in a way that is unprecedented in this country's history and the history of the world. And so, that we're talking about the issue of parole and clemency specifically for people who are older. but that's in part because they got long sentences to begin with. And then on top of that, weren't able to be released because of the nature, in some cases, because of the nature of the crime. And there's research that shows that people who are older age out of criminal behavior, quote unquote, don't reoffend. And there's a lot to unpack in what those words mean. But in terms of public safety, keeping people inside prisons for decades doesn't make us safer. In terms of economics, it's spending our money that could be going to good healthcare and good jobs and education on endless punishment. And then there's a moral question of, like, I don't know how much punishment people think people deserve, which is that's a less scientific question to ask. But we've invested in all these things. And so now we're in this moment where states are struggling to get enough PPE and ventilators to the general public. And yet our budgets towards prisons and incarceration and policing, and we're still trying, I mean, de Blasio or Cuomo are still putting more money for more police officers on the subway. Mm-hmm. And so that broader picture shows like how our investments have been in things that actually haven't made us safer. And in fact, have taken away resources from the things that we actually need. And yeah, go ahead.
No, but I want to just stop there and just go back or go to one of the questions that we've got from the audience. So there is research showing that elders are not likely to reoffend after being released, correct?
Absolutely.
Absolutely. Okay. And so what is our strategy, your strategy for convincing the public that the decarceration of elders benefits society as a whole, right? That it is not an issue of public safety, but as we're suggesting, one of public health and human rights and people's right to health.
That was for me?
Mark, if you'd like to pick it up, sure.
Okay, well, Melissa, you were about to say something before I jump into that?
It's okay, you can go.
Go ahead.
I was just going to say the research that we have is that people who are 55 and older, the recidivism or risk of reoffending is less than 3%, which is practically nothing, when the national average, I think, is like 60% or something. So if we're going to start thinking about decarceration and reducing mass incarceration, that's a great place to start because the risk to public safety is very, 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 very minimal. So I think that that's the argument that we use just on a regular basis. But then also just for us, we know so many people who have come home and not only are they like less risk of reoffending, they add so much to society. They add so much to our work. The RAP campaign is led by people who are formerly incarcerated elders. So we also try and bring that into the conversation, that they're a benefit to society. And then also, like I said earlier, like we don't even know the public health, like what's going to happen to family members who are so stressed out about this situation, the mental and physical health of people who are dealing with the burden of having someone who is incarcerated. Like I said earlier, when my dad passed away, I think it caused me so much more stress that he wasn't home and that I couldn't take care of him. And so the impact that has on community members and family members, that's another aspect of public health to take into consideration.
Well, you've just answered one of our questions from the audience. What's the argument and strategy for releasing prisoners? So thank you for addressing that. I've got another question. Is it possible to bring a collective court emergency action in New York on their behalf? And I think this also maybe is an opportunity just to talk about your efforts to petition. I think it's hashtag Cuomo, let them go right now. So
that's one, and there are a couple of others. Go ahead, Cam.
Richard, if I could just chime in back to the other question before we move on to the demands around Governor Cuomo, which is there has been a change in consciousness around prisons, incarceration, and punishment in the last X amount of years, let's say 10 years. Since the new Jim Crow came out, that's one marker of the rise in consciousness. What the RAP campaign is doing, and some of what the Center for Justice is trying to do, is specifically take on issues of violence. So at least some of the folks who are older inside prisons have been convicted of violent offenses. And as a result, many times, I mean, the parole board is a whole other conversation, but as a result, in part of their initial offense at the parole board are not being released. And part of the work that RAP is doing and that the center is involved with, in part working with RAP, is to take that on and say, if we actually want our country to be, or our communities to be more safe, we have to rethink how we understand violence and rethink our responses to violence. And keeping people in prisons for the rest of their life because of a violent offense is not actually making us safer. And I just, in the larger landscape of trying to get people out, it's still hard to get people out, period. But a lot of the discourse is like, let's let out people who have been convicted of nonviolent offenses. And we're trying to take that on and say that let's let them out, but let's let a lot of other people out who don't need to be inside.
Okay, so thank you, Cameron, for providing that context. I think, sort of going back to, I guess, the more general question of, well, what can people do to support these efforts, this movement? What are your recommendations?
Well, thanks to our resident tech guru, Melissa, and Cameron, we have a new website, cuomoletthemgo.com, that outlines our current demands and provides opportunities for people to log in and get involved in any way that they think is possible, under the circumstances for themselves. We have the hashtag, as you pointed out, Cuomo Let Them Go. Another hashtag is Clemency Coast to Coast, the number 2. Hashtag Free Our Elders. RAP has a website as well as a Twitter page. People can reach out, in any way that is comfortable or accessible for them, but they can definitely visit our website to find out several ways that they can be involved if they would like to help.
All right, thank you. And circling back once again to some of the comments that you made, Melissa, about reentry. So what are the programs in place for these elders, and I mean, anyone who might be released? How will they be assisted in their transition?
Yeah, so there's a couple of nonprofits locally in New York that provide reentry services to people just generally, but then there's also a couple of elder specific ones. I used to work with the Osborne Association. They have an elder reentry initiative that has worked specifically with the unique needs of people who are older, working also with local nursing homes to try and get them to be a little bit more okay with bringing people into their nursing homes who are older, which obviously right now with COVID-19, those are really hot spots for the illness. So that's an issue right now, I guess. But also the parole preparation project who RAP works with helps to get people home, and then also provide support for them when they're reentering society. So there's different places that are offering it on a regular basis, and then also trying to adapt to our new normal right now. But like I said, there's plenty of family members and community members who need support as they're bringing people home, but who would much rather have them in their care than in the care of the Department of Corrections.
Hey, and maybe also thinking about people who might have special needs. There's a question here. We have recently learned that in New York City, despite rapid release of many with minor offenses or parole violations, prisons and jails are not releasing people with serious mental illness. Are there any advocacy efforts currently working on this issue?
To my knowledge, well, first of all, RAP does not exclude or disregard anyone, regardless of crime, sentence, in terms of our advocacy initiatives. I'm not personally sure about that specific area, but anyone who is released will be more than taken care of by our allies. I mean, RAP itself is not a reentry service provider, but we are partnered with and have close working relationships with several agencies providing those services. If there's anyone specifically, that is in a situation like that, they could also reach out to the Parole Preparation Project. They have their own website, and that is our sister organization that we work with, which is also at this moment and has been for the last few weeks providing mutual aid to prisoners and their families.
Yeah, I imagine I mean, the thought that's in people's minds might be that, if people are released from prison and don't have the support of a program or a family to rely on, that, they're going to be joining, the homeless population. And so at a period when our resources are stretched thin at best, if not utterly inadequate. So, what what kind of choice are we being forced to make here? Is I think part of the concern. I have another question here. My uncles passed away last week due to COVID-19 in a Peruvian prison. So I'm so sorry to hear that. Overpopulation in prison is 600% in Peru. What can one do for the international community? I have other family members still in prison here, and I'm just curious. I mean, is there international dialogue about these issues? Is there something that we as a university, Cameron, and the Center for Justice can do to sort of look at this in more global terms?
Yeah, I mean, I can say one thing. I'm sorry to hear about the passing of your uncle, and I think there has been and is maybe an increasing efforts for solidarity outside of borders generally. Work around prisoners in Palestine has sort of gotten a good amount of attention, and there's a lot of work happening across the U.S. and Palestine to get people out. Guantanamo Bay is another place of incarceration that people have been trying to get released from. I don't know anything about Peru. I think, one of the things that this crisis has shown is like the federal government in our country cannot be relied on to meet our basic needs. And as much as we want a social welfare state, and we should be fighting for that, we also have to work to meet our own needs. And this campaign from RAP is a community-based need. The mutual aid is a community-based need. And so just the work to free people in Peru, it needs to happen from the ground up. And yeah, I'd say that.
Mark, you wanted to add something.
Yes, for an international perspective, besides health professionals, celebrities, legal professionals, we have also had calls and pleas, from the Pope as well as the UN in support of essentially of our demands here locally. And I'm reminded by that question that there is a British-based group that pretty much does the kind of work that the questioner presented. I cannot recall it right, the name of the group or the link to their website right now, but I will be more than happy to share that, and perhaps that person can, get involved, from that perspective.
Absolutely. We'll post resources and links and everything else on our website in connection with this program. I want to go back to a question that came up a little bit earlier. I think it may be in response to what Cameron was saying about thinking about definitions of violence. And an audience member asks, can you please speak to the rise in domestic violence during this time, and how to balance the rights and health of those in jail with the safety and health of survivors of abuse? So I'll open it up.
I mean, I'll try and be quick, and so other folks can chime in. And there has been a lot of work, and there's a growing body of work from practitioners, scholars, activists, organizers to say that our punishment and incarceration as a response to violence actually doesn't meet the needs of survivors and doesn't make us more safe. Danielle Sered put out a book called Until We Reckon. I highly recommend that. In terms of domestic violence specifically, there's a woman named Mimi Kim, who is a social work professor at the University of Long Beach and also started something called Creative Interventions, And her work has both been about the history of social work's reliance on law enforcement to respond to domestic violence and the impacts of that on marginalized communities, and that working towards transformative justice, which is a longer conversation, to create different responses to violence. So I'll stop there.
Thank you. Mark, you wanted to add something, I think?
No, I think Cameron covered it beautifully.
Okay. Yeah, transformative justice, I think, is a key term, an idea there for us. I hope to address.
I'm sorry.
No.
Something just occurred to me. I did think that the question was somewhat disingenuous, because people incarcerated, have nothing to that situation. That's like apples and oranges. We're talking about things taking place out here in society, with domestic violence. I don't see the connection between, our focus on freeing incarcerated people, for public health and safety with that particular issue.
Mm-hmm. So going back to our issue of decarceration, what can people do to volunteer? What are the opportunities out there to sort of step in and help?
Well, as Mark mentioned earlier, the Cuomo Let Them Go website, it has a tab that says take action, and it has all of the things that people can get involved in. So there's a petition there that you can sign. There's a lot of social media actions we've been doing. We've been using, obviously, social media a lot more as a way of organizing and doing advocacy. So you can follow the RAP campaign on Twitter. And we've just been doing a lot of targeted campaigns at Cuomo, having people tweet out selfies, holding a sign, say Cuomo Let Them Go, partnering with people in California to do the Clemency Coast to Coast campaign. We have call-in campaigns to call the governor's office. So all of the information for what you would need to get involved are on the Take Action page of the Cuomo Let Them Go website.
All right.
There's also a tab on that site honoring and memorializing people who have passed away in prison from COVID-19 virus due to Governor Cuomo's inaction.
Okay. All right. Well, thank you, Mark Shervington, Melissa Tanis, and Cameron Rasmussen for joining us today on Social Impact Live. Really appreciate it.
Thank you for having us.
That concludes today's program and also our regularly scheduled season of Social Impact Live 2019 to 2020. I want to take this opportunity to thank all of our guests this year for sharing their time and expertise with us on the program. I'd also like to thank our technical production team here, especially John Bone, Katrine Kalkatanidis, and David Licata for the amazing work that they've been doing every week to get this program out there on Facebook Live and YouTube. And most of all, I'd like to thank you, our viewers, for being a part of this community and for all that you do now more than ever to attend to the needs of vulnerable and underserved people everywhere. So thank you. Please take care of yourself as you take care of others. Stay well. And I look forward to seeing you when Social Impact Live returns again. So goodbye for now.